why don't we begin with a quick introduction to the company and what you're focused on accomplishing?
Prenuvo is a proactive screening company where we provide our customers with the physical of the future. It's a 45-minute to 60-minute exam inside our own clinics where we put patients in these custom-built research-grade MRI machines. We take thousands of images of their body and then have a wonderful team of radiologists that go through those images and provide patients with this organ-by-organ blow about what's going on with their health so that they can take control and work towards having a better health trajectory in the future.
Welcome to the Analyzing Healthcare podcast, brought to you by Scale Community. Scale is a global healthcare-focused member network where healthcare leaders come to connect, learn, share ideas, and shape what's next in our evolving healthcare landscape. To take advantage of all that Scale Community has to offer, from expansive content to virtual and in-person events to interactive peer networking opportunities and more, check out Scale Community at www.scale-community.com. Membership options range from free to paid, so if you enjoyed today's discussion, please take a moment to sign up for your preferred membership level. All right, welcome to our next Scale Community Technology and Innovation within Healthcare podcast, where I'm joined today by Andrew Lacy, the CEO of Prenuvo. Andrew, welcome to the podcast.
Thanks, Jason. It's great to be here.
So why don't we just maybe for those that are less familiar with Prenuvo, begin with a quick introduction to the company and what you're focused on accomplishing.
Sure. So Prenuvo is a proactive screening company where we provide our customers with something like the physical of the future. It's a 45-minute to 60-minute exam inside our own clinics where we put patients in these custom-built research-grade MRI machines. We take thousands of images of their body and then have a wonderful team of radiologists that go through those images and provide patients with this organ-by-organ blow about what's going on with their health so that they can take control and work towards having a better health trajectory in the future.
Interesting. So AI-driven radiology business.
Well, yes and no. We use AI very judiciously in the company, but there's a lot of, I guess, what you could call sort of AI washing going on in the world these days. I mean, everyone is using AI, and I think a lot of people are inflating the impact of AI on their businesses. So I think in the long run, AI will have a huge impact on radiology. In the short run, this is still mainly a sort of people-run business. It's a clinical practice. And so we have these highly skilled radiologists that are really spending a lot of time looking through these images, looking for the slightest little details and trying to understand through all these different sequences that we take that filter your body for different tissue composition. Really, what is it I'm looking at? What is that thing in the liver that I'm looking at? Is it something that's benign that I don't need to worry about? You know, something that all of us have, sort of like little internal pimples? Or is this something that is potentially concerning that then we would need to do some more tests to further characterize? And those things that are concerning might end up being cancer. Obviously, when we do that, then that's a potentially life-saving finding that we've made for that customer.
So a high-quality radiology business where there's just a greater level of attention to detail. Is that a better phrasing of what Prenuvo is?
Yeah. I mean, we can dive into how we use AI. I think that's an interesting conversation. But I think at the core, one of the things that differentiates us is that we're a real clinical practice. We want to make sure that the customer has, first and foremost, an incredibly accurate clinical exam, and they have a great in-clinic experience in the process of doing that.
And what conditions are you focused on? Because imaging can cover everything from cancer detection to breaks in bones. So are you running the full gamut of all imaging needs, or is it just MRIs, just CAT scans, just X-rays, just certain conditions?
So we use predominantly MRI. And I should be careful because MRI, the sort of stock standard MRIs that you get in imaging clinics may not necessarily be able to work as well as the ones we have because these are custom built, very expensive MRIs that are research grade. And we use these MRIs to really help patients understand three things. The first is there anything going on inside my body that I need to know about now because it can potentially life-threaten? And in that category are obviously cancer, which we hope and love to catch at stage 1 or stage 2, because a typical stage of detection in the medical system is stage 3 or stage 4. It's aneurysms that we can get in the brain, in the abdomen, around the aorta, so around the heart. And these, if they burst, are almost always fatal. So catching them before they burst is really the holy grail. And that's the first category. The second category are helping me understand and connect the way I'm living my life with the underlying physiology of my body. So what does that mean in plain speak? It means, can we identify the very early stages of chronic disease with these scans? How can we help you understand that there's a disease process here that's starting that may take 20 years to play out to arrive at this chronic stage? But we can see the hallmarks of it now at a time when sometimes you just need very minor lifestyle adjustments to make a huge difference in the outcome for your health, or for whether that condition ever arrives at something like dementia or metabolic disorder or debilitating MSK pain and lack of mobility. So in some ways, we're redefining these chronic diseases to things that are to sort of include this stage that is the non-chronic stage when you can do something about it. And then the third thing we help people understand is just how they're tracking more broadly. So what can we tell you about how your spine looks relative to your biological age, or your brain looks relative to your biological age? And what we learn from this is everyone has something to focus on. A function of the way we live our lives, or our genetics, or just luck. There's typically organs or systems of the body that each of us have that should be really our primary focus. They're going to be the Achilles heel as we age. And knowing that can be really empowering for folks.
I spoke with someone who was in the whole body imaging space, and they explained to me that a whole body image wouldn't be feasible without AI, because you'd be in the machine for too long, and it's just not feasible or practical. So the key difference that's allowed this to happen was AI imaging. Is that right? Is that what's unlocked the ability to have whole body imaging today, or is that an oversimplification?
It's a massive oversimplification. The hardware has evolved a lot in the last 10 years. I mean, MRI, think of it, is like a 30-year-old technology. So there've been MRI machines around for about as long as there's been, mobile phones that could take photos. My Nokia sort of circa 1995 mobile phone could take photos, but those photos aren't anything like the photos I can get from my sort of iPhone 16. So the hardware has improved a lot, and in a lot of ways, that's what's brought down this sort of scanning time. AI does play a role in speeding up image acquisition or improving the quality of the images that we're taking. And it's important to understand that there's often a choice. You can acquire much fuzzier images and try and use AI to sort of make up the quality, or you can take the same amount of time and use AI to increase the quality, make the scan more accurate. And every company that's using AI has to make those choices. And the choices that we make are governed by a clinical practice that wants to ensure that the peace of mind that you get from these scans are real. That you can rely on it, is dependable. And I think that's the risk with AI, is that people put in the wrong hands. You can end up with a screening that may not be diagnostic.
So let's talk about the patient experience and all the reasons why working with Prenuvo, the patient experience would be different, presumably for the better. But let's sort of have two camps. One is versus traditional MRI imaging. Presumably, it sounds like you can go for a whole body scan in other settings as well. And then let's talk about some of the newer entrants to the market that are focusing on technology as the key differentiator and AI as the key differentiator. So maybe beginning at the front end of the journey and then taking us through the end where you get your report. What is that experience like, and how is it different and better at Prenuvo?
Yeah, so I think one of the main differentiators is we operate our own clinics. So there's sort of two models here. The first model is that you're sort of vertically integrated, and that means that you sort of pick everything. You choose to build a clinic environment that helps people feel less anxious about their health. MRIs, some people find them claustrophobic. So we want to create an environment that's sort of very welcoming, doesn't feel medical, doesn't trigger that anxiety. So you can choose what hardware to put in those clinics. You can choose which radiologist to use and focus on radiologists that are specially trained and get a lot of practice on whole body screening. The other model is a virtual model, and that's where you contract for third parties to do that imaging for you. You don't control the environment that the imaging is done in. You often don't control the hardware that the imaging is done on, and you don't get to say which radiologists are doing the reading. Typically, the radiologists that do the reading are the ones that are attached to those centers. And those radiologists may spend 95% of their time reading knees and shoulders, and may spend very little time doing whole body. And I think most people would agree that mastery comes through repetition. And so these scans are very complex. They acquire something like 10 times the amount of imaging that a regular single body part scan does. And so it requires a lot of practice to be able to read them at a very high level of accuracy. So those are the two models. And you can see how each model sort of plays into the experience you get when you come into the clinic, play into like the quality of the imaging that you can like inherently get out of the machine. Because some imaging clinics out there are still running hardware that's 20 or 30 years old.
Mm.
And then finally, that radiology layer becomes really important in terms of the overall accuracy of the scan. So unfortunately, a lot of consumers don't realize this. They think of imaging as like a blood test, kind of more or less commoditized. It doesn't matter if I go to Quest or LabCorp, they're both going to read my cholesterol. Imaging is very qualitative. It has more to do with, say, heart surgery than it does to do with a blood test. If you need heart surgery, you're going to check what are the right facilities to go to and what surgeon is doing the exam and how experienced are they. And the same is true with whole body imaging.
So best-in-class hardware, best-in-class scanning, technology. It sounds like you are using AI on top of that as well, or okay, so AI technology and then the people-driven provider component. So integrated hardware, AI technology, and best-in-class people. How do you go through on that third bucket of the best-in-class people? How do you go through recruiting, training, retaining the talent to allow for the differentiated people components? And what's interesting is that is seems to be an important part to the puzzle here.
Yeah, I mean, it's really interesting. We brought on a new chief medical officer about a year and a half ago. He sat down with me and said, Andrew, what you need to understand is that radiology is a very supply constrained market right now. And your biggest challenge is going to be hiring radiologists, as you grow. And a year and a half later, it's turned out that we have more radiologists that want to work with us than, we would like to hire or can hire or need to hire given the volume of the business. And so what did we really misunderstand here was that a lot of people join the medical profession because they want to make a difference to people's lives. They want to save lives or put people into better health. And this reactive healthcare system that we have doesn't really create many opportunities for that. And particularly in radiology, especially those radiologists that read MRIs, a lot of time that's the last imaging modality you get. So you're doing an MRI not to find cancer, you're doing an MRI to figure out, exactly where has it metastasized to. So the ability of that radiologist to save lives is pretty limited, to be honest. And so what we found was there were just a lot of people out there that were so frustrated that they had spent so many years of their life studying medicine to save lives, and they weren't given the opportunity to do it. And they saw Prenuvo as a real opportunity to renew their career. And so we ended up attracting a lot of, I guess, like mid-career and even late career, very experienced radiologists and medical practitioners that wanted to sort of like, be reminded of the reason that they had entered medicine, to not be sort of paper pushers, but to be really playing a role in saving lives. And so we've been really fortunate, to be honest, to be able to pick people that have studied at Ivy League institutions and, they could work absolutely anywhere, and they choose to work with us because they really believe in what we're doing. And that starts with like the quality of the images that they're reading. They look at them and say, I've never seen anything like this anywhere else. And that's why I want to work here. I mean, every time you get a medical report, they sign that report. It's their name. If something goes wrong, it's not just the business that gets sued, also it's the radiologist. So they're really excited to work with a practice that cares about, the clinical quality of what they're doing.
And how big is Prenuvo today in terms of clinics and number of patients seen?
We have 23 clinics in North America. We just opened one clinic in Melbourne, Australia, which is where I'm from. I don't know if you can tell from the accent. So finally, I have a clinic that my parents can get screened at. And we're about to open in the UK as well in a couple of months. So we're starting to expand geographically too. And I have a medical team that's about 100 people, primarily radiologists, but also preventative medicine specialists, nurse practitioners. I mean, it's a big practice of people.
Those 23 clinics in the States, where are they geographically concentrated or dispersed around the country?
They're dispersed. Most large metro areas where we are legally able to operate, we have clinics. And most people should now have a clinic within a couple of hours of that.
So with all the benefits that you mentioned, because it sounds great, it's a quick scan, an hour out of my time, and I get to scan my entire body for early signs of malignancy. I get to look for early signs of chronic conditions. So a lot of benefits. Why have I never had a whole body scan? I've had lots of other preventative care, but never a whole body scan.
I think, the reality is it's still relatively new. Not a lot of people have heard about it. I'm constantly amazed because when you're building a company, you're just living and breathing it every day. You just can't imagine that people wouldn't have heard of it. But I would say we're still dealing with like small single digit awareness that this technology exists. And then secondly, and we see this in how long it takes from the moment someone hears about us to the moment they come in for a scan. That lag can be quite long. And I'm fascinated by that. And I think a big part of it is that the reactive healthcare system that we are so used to has supplied us with so many, unfortunately, scary stories about people, having disease caught late. I mean, you don't hear a lot of happy stage 1 stories, or you don't hear a lot of stories about aneurysms being caught before they burst, and so on. That it's sort of made us afraid to really understand things about our health. I mean, it's created such a level of fear that people would rather put that off than sort of like come to terms with what's going on inside their bodies and live a more proactive sort of life. So I think there's a powerful psychology that the health system has embedded in most individuals to not want to look inside. And I think it's always a brave step. And whenever I see people in the clinics, that's the first thing I say is, congratulations. Like the hardest part was like getting the courage to come in and take a different approach to your health.
Well, I mean, I'm curious where the referrals and where the patients are coming from and how they're finding you. I mean, when I think about the preventative tests that I have, they usually come from my primary care provider, or, if I have something going on, they come from the specialist that I'm seeing. So how are patients finding Prenuvo?
So we originally were very direct to consumer. I would say we now have hundreds, maybe even over 1,000 physicians that are referring us patients routinely. So the mix of business has changed a lot. And it makes sense. Consumers are earlier adopters of new things, and physicians are understandably a little bit more conservative. But these days, there are hundreds and hundreds of physicians that are referring patients, are encouraging patients when they ask about it, and many have incorporated us in their annual process for their own sort of cohorts of patients. So the tide is changing probably faster than it has for any other preventative medicine sort of like protocol, but it still feels pretty slow. I mean, for me, it's been a 6-year journey to get to a point where there are physicians that are encouraging and many physicians are indifferent, but way fewer are against. I think 6 years ago, most physicians were against, mainly because they didn't really know anything about the technology or the sort of quality of imaging that you could do these days.
And are the referring providers mostly primary care providers, or is it dispersed across other specialties?
It's a mix. I would say probably 80% primary care. The remainder might be sort of oncological specialists or some functional medicine specialists or naturopathic doctors. It's a mix, but it's primarily primary care. I mean, the goal here is my team internally sort of quips that what we're doing really is primary care radiology. We're taking what you used to do when you went into the clinic for your annual physical, and they'd sort of push and prod on your body in the hope that they'd find some massive tumor or what else they're looking for pretty ineffectively, and replacing that with something that is just way more sensitive and able to pick up a lot more conditions.
I'm curious, it sounds like you shifted from the early stages of direct to the patient focus, and now you're more heavily weighted towards the referrals, and you built up quite a universe of referrers across your clinics. How did you go about building that referrer universe? Was it a feet on the street sort of door-to-door model? Was it strategic partnerships with health systems or employers or large provider groups? What was the strategy for being able to build a fairly large referral group in a fairly short amount of time?
Yeah, I mean, look, there's no, I would say, hack to it. Unfortunately, the way we've built the business on the consumer side and on the physician side is just this belief that if we provide a great service, people will come and people will talk about it. And I learned pretty early on that absent firsthand information, a lot of physicians were skeptical. But if we gave those physicians an opportunity to really either send a patient through or come through themselves, we turned sort of 80% skepticism into 80% of physicians referring us that have that firsthand experience. So it was like a huge information asymmetry.
Where does the skepticism come from? I mean, I would think at least on the early detection of cancer that's maybe I'm naive in this, but I would think it's a fairly black and white sort of component. So we'll get into the question of cost and insurance coverage in a moment, but just on the skepticism, I'm just curious where that comes from.
Yeah, I think so. if you go back now 25 years, you could go to an average shopping mall in America, and there would be a business there that would be doing whole body screening with CT. And you could pay a few $100s and get there, or $1,000. I actually know what it cost. But what I do know is it was a horrible technology. It was not low dose CT. It was high radiation dose CT. CT is not good at finding a lot of cancer and illness. It's a spinning X-ray, so we know X-rays are good at bones, but for other organs, it doesn't function as well. And it was so disliked by physicians and even the FDA that it sort of like got shut down. And it created a negative, I think, association in a lot of physicians' minds between, like imaging-based screening, and it's sort of like, put a different way, I guess it sullied the waters around sort of using imaging to screen otherwise healthy people. And I think 25 years later, that's still in the back of the minds of many physicians.
So is whole body imaging still necessarily on the fringe? Or, I mean, can I go to a hospital and get a whole body preventative scan if I wanted to?
Yeah, believe it or not, you can. Most large tertiary hospitals do whole body screening. The only problem is they don't do it for you. They'll do it for people that have typically a genetic cancer predisposition syndrome. So they don't necessarily have a problem with the underlying technology. That's the only insurance at the moment traditionally only covers this for a very small number of genetic conditions where you have a very high likelihood of getting cancer multiple times in your lives. And by the way, the cost of that is $50,000 to $100,000. That's what insurance companies are paying for that. And so they do it. They believe in it as a modality to find cancer early and other disease early. But because it's not been insurance reimbursed, it hasn't really been offered to the general public.
So that's a good segue to the topic of pricing and insurance. So in the hospital, it sounds like quite expensive, prohibitively expensive, 50 to 100K, and only covered in a pretty small specific use case. So how about in the Prenuvo environment, pricing and insurance?
So the cheapest exam we have is $1,000, and it screens for cancer in the torso. The most expensive scan, the scan that most people get is what we call comprehensive, which is $2,500. So it's already an order of magnitude cheaper than some of the alternatives out there. The challenge with insurance coverage is that we haven't been very good at adopting new paradigms very fast. Mammogram was a technology that was proven clinically in the 60s, and it was adopted and paid for by insurance in the 90s. Pap smear actually was a test for cervical cancer, was first proven in 1910 and was not covered until the latter half of last century. PSA took 15 years. A low-dose CT for former smokers took 20 years. So it just takes a long time for these technologies to be adopted. And part of the reason for that is that the clinical studies that are required oftentimes to support population-based sort of reimbursement involve millions of people and involve assessing reductions in all causes of mortality that, over 20, 30, 40 years. And so unfortunately, it's going to take a long time. But there are many wonderful technologies that have saved millions of lives that take decades to get covered by insurance. So you also you can't conclude anything. You can't conclude that the scans aren't great just because they're not covered. It's just that it takes 30 or 40 years for them to feel satisfied that this is something that we want to offer on a population level.
Yeah. I mean, my sort of interpretation of this is that to some extent this technology exists, and I'm saying technology, but it's really a service, exists outside of the way that most people consume healthcare, right? So most people go to the primary care, they go to the specialist, they have insurance-based reimbursement, they have a battery of preventative screenings that they're used to, whether it's colonoscopies, you mentioned pap smears, but it sounds like this technology has made some inroads in getting integrated into the traditional care ecosystem. For example, you're now getting a lot of referrals, but still a couple key steps to go. Insurance reimbursement being one of them, continued penetration of referrals being another. What are the other key milestones that you look forward to in terms of integrating Prenuvo into the care delivery ecosystem? Or maybe that's not the goal.
Yeah, I think it's an interesting question. If you ask me, Andrew, Lacy, the CEO, I mean, we're doing research studies now. We're collecting evidence. We want this to be something that's covered by the health system. On the other hand, the health system is uniquely interesting, and it's the only insurance product where really we have this expectation that the insurance is going to keep us, keep us in a state where we don't need to use it. It's going to keep us healthy. I mean, I have insurance that my house is not going to burn down, but they're not coming to check that I'm not doing anything stupid with the stove. And so, on an individual level, I think the way I think about what we do at Prenuvo, I sort of put it in the same bucket as having a gym membership or buying organic food. There are things that we can also take individual responsibility for if we're fortunate enough to be able to do that. And because I really hope that these are covered in 5-10 years. But if it takes 30 or 40 years, we may not be around to see the results of those studies being published. So that's just the unfortunate reality of the healthcare system we have today. It's very reactive. It's not proactive at all. I wish it was. I think it would be half the size it is today if we focused on proactive healthcare, and there'd be better outcomes for everyone. We have a longer life expectancy, but that's not the system that we have.
Would I, as a patient, know what to do with the results of the report? So on the first part, again, cancer screening, I feel like I would either have a positive indicator that there's something cancerous or negative, and I'm free. On the second, I almost think about genetic testing where, I get probabilities of this materializing into something, and it's interesting, it's informative, but, I don't necessarily know what to do with it as a patient. I'm just wondering, would I know what to do with the report here?
Well, Jason, it sort of depends where you go. I mean, a traditional radiologist typically didn't provide a lot of advice. I'll give you an example of a traditional finding that a radiologist out there in the sort of traditional radiology world, how they would describe something. They'd say, 3-centimeter lesion in segment 4 of the liver, neoplasm cannot be excluded. And neoplasm, for the people who don't know, means cancer. And they would give that to the primary care provider whose job was to figure out what to do with this together with the patient. And when I came in, and started to see these reports in the very early days, 6 years ago, I'm like, this doesn't work for me, as a patient. I want to know what to do about this. And by the way, radiologists see these things a lot more than the primary care provider does. So they have more context to be smarter about those recommendations. And so we decided as a business from the very beginning that we would go further and we would provide not just the finding, what we see, but also what we think you should do as a result of that finding. And that was pretty novel, believe it or not. I mean, if you come from medicine, that's novel. If you don't come from medicine, you think, well, that's just good product. But it was pretty innovative. And the goal, therefore, is that patients go away from these exams feeling very empowered and able to sort of advocate for their own health. Oftentimes, they may know more than what their primary care provider knows about some of these conditions that we might be finding when we look inside.
I want to kind of zoom back for a second, or zoom out for a second, and now talk about the healthcare landscape with Prenuvo. So let's imagine you could kind of set up healthcare however you wanted, and Prenuvo would be used in the way that you think makes the most sense. So really the fundamental question is what would the healthcare delivery landscape look like? But a couple of specific questions. Would patients still be going for colonoscopies? Would they still be going for mammographies? So what things that we're used to would be replaced by this? And how often would I be going as a patient for this service? When would I start? So what's the right sort of ideal utilization of Prenuvo?
Well, let me zoom out as far as I can. All right. So let's sort of do the universe view here. In the US, we spend $5 trillion on healthcare. And about 40% of that is paid for by the government. One way or the other, either directly through Medicare or Medicaid or VA. So it's a massive amount of money that is being paid for by the government. If you go forward 15 years, on current course and speed and the way our population is aging, that 5 trillion is going to be 15 trillion. And that 40% is going to be equivalent to the entire federal budget today. So people aren't really understanding potentially, and certainly not talking about, the fact that healthcare will absolutely either bankrupt the entire economy in 15 years' time, or we're going to have to ration care in a very extreme way to balance that budget. So now is the time to talk about, I would say transformative changes, not incremental changes. And, we spend of that $5 trillion about less than 5% on what we would consider preventative screening or preventative healthcare. That's wellness checkups, that's colonoscopies, that's mammograms, and so on. And the other 95% is like just completely reactive care. If you double click on cancer, we spend about 130 billion, maybe it's 150 billion dollars today on late stage cancer drugs. We spend the same amount every year researching more late stage cancer drugs, in the R&D groups of like pharma companies. So that's like $300 billion. $1,000 cancer screening exam that we do at Prenuvo, we could do once every 2 years for every adult in the US for about $60 billion. So if we were able to, instead of spend 5% of that budget on preventative health and spend something like 15 or 20%, I think we could probably halve the amount of money we're spending on healthcare over the next 10, 15 years. That's what I fundamentally believe. And I don't think that means that you don't do colonoscopy or mammogram. Those are great tests. I think that's an adjunct to what we're doing at Prenuvo. But Prenuvo is just such a wonderful, comprehensive exam for a relatively short period of time. Of time commitment. I'm an entrepreneur, so I'm all about sort of 80-20. What is the most yield I can get for the least amount of investment of time and money? And I think these exams are really a wonderful example of that. And when paired with blood testing and the existing standard of care, I think we could change the paradigm of healthcare in the US.
So not necessarily a replacement to the tests that we're used to, but it sounds like every 2 years type frequency would be the recommendation. This would become an incremental test in our lives.
Yeah, I mean, the standard of care tests for cancer, they only catch 14% of all cancers. So the other 86% are typically caught when you present with some type of symptom, or if you're lucky, you had a car accident, and you had to go get a sort of dedicated MRI and they found something, incidentally.
Do you, and I don't know if the sample size is big enough, but do you have statistics on, I don't even know how you would necessarily track this, statistics on the outcomes of patients working with Prenuvo? So you mentioned the sort of cancer detection rate, maybe Prenuvo is 2x that, and then also from a cost metrics perspective, savings delivered to the healthcare system by adhering to the Prenuvo protocol.
Yeah, I think right now we've got what I would call economic models. We know cancer is really well studied, but a lot of other conditions that we see, like metabolic conditions or musculoskeletal conditions or dementia, I mean, there's so much population level cost data that we know, for example, what the average cost is to treat a stage 1 cancer. And we know what the average cost is to treat a stage 4 cancer. And we know what the average survival is of stage 1 versus stage 4. And we can there are pretty well established economic models that can sort of intuit an ROI from those, from catching cancer early or catching, metabolic condition early where you can reverse it versus needing liver transplant or needing dialysis, things like this. So typically we have these models that show a really awesome ROI. And that's why, there's a third stool to sort of our customers, which is enterprise. And that's why we have a lot of employers that are footing the bill for the health costs of their employees that are very interested in incorporating some of these scans into their health benefits for their companies.
I would think that, if there is an economic model here that is compelling, that some of the underwriters of healthcare, whether it's a risk-based primary care group or a self-funded employer, that they could show interest in the Prenuvo solution. Have you started to have conversations on either the employer side or the risk-bearing provider groups?
Yeah, I think, by the way, a lot of people consider, the question they ask is, are you being reimbursed by insurance? But I think what a lot of folks don't appreciate is that the overwhelming majority of us work at large employers where the health costs are being paid for by the employer directly. And so the right question really is, what does it take for employers to get on board? And what's sort of kind of interesting and quite cool, actually, is that the employers that we have already had traction with are employers that are different to what you typically hear about. They're not the Silicon Valley, Netflix and, Facebooks and these types of companies. It's more blue collar. It's companies that have employees that stick around for a long time, for which their companies are much more heavily invested in keeping them healthy. that have a higher occupational risk of cancer and disease. So these might be firefighters or manufacturing companies or oil and gas, agricultural companies that, they know their employees are going to get sick potentially at some point in the future, and they're going to bear the cost of that illness. So they want to catch it early. So that's where we're seeing traction, which is nice because, those are the employers that, typically they're the last to get cool and exciting benefits. And it turns out that in this world, actually, they're the first because that's where the biggest ROI is.
I want to move over to competitive landscape, but there was a thought that sort of came to mind from something that you said maybe 10 or 15 minutes ago about the old CT scans in the malls where they did the whole body and there was a unsafe level of radiation. So maybe just on the topic of safety, should I be concerned as a patient going to get a whole body scan every 2 years?
No, I mean, there's a small number of conditions that mean we can't screen you. For example, people have pacemakers, and there's a few other very, very rare implantable devices that make it unsafe to do an MRI. I'm not talking about fillings or hip replacements or all these things are no problems. Other than that, we use what's called electromagnetic radiation. So this is more like sort of AM radio than it is anything dangerous. And so we put the equivalent amount of energy in your body in these exams that you might get talking on a cell phone for a couple of hours. So they're very safe. You can do them as many times as you want. We don't inject any contrast, so there's no accumulation of heavy metal that you get with contrast. We really wanted to design a scan that was high quality and completely safe so you could do it every year without it increasing the risk of cancer.
So on the competitive landscape, and it's really an market outlook question, but about what your peer landscape is going to look like in the next couple of years. So if you detach whole body scans from Prenuvo, so we're just talking about whole body scans, you're a strong advocate for whole body scans done correctly at a cost efficient price point, and it should be part of our ongoing healthcare recurring routine. Is that a fair statement?
Yeah, for sure.
So then the question is, how do we pay for it and who does it, right? And so how do we pay for it? I think we talked about, although I have a question that I'll come back to on that topic. So it's more the who does it here. And so I could go to the hospital. It sounds like the hospital is very expensive. I could go to a Prenuvo that's standalone. I can go to another large radiology player, and maybe those large radiology players will consolidate the whole body scan market, in the future. And then I know one of your peers, Ezra, was recently acquired by Function Health, which is sort of in the longevity space. And so maybe there'll be a new crop of players that will emerge that will be focused on longevity and incorporate this in. So if you had to predict where Prenuvo goes and how Prenuvo proliferates in the market, do you think it'll be standalone? Do you think it'll be moving more longevity bent? Do you think it'll be as part of a larger radiology player, as part of another larger healthcare network? What does Prenuvo look like 5 years from now from that perspective?
I mean, it's really hard to know with a lot of precision, but I would say, where we already understand that it is obviously very expensive to roll your own clinics everywhere around the world. And our primary goal for doing that was that we wanted to make sure that the clinical quality was excellent. But as we get better at sort of managing our own operations, we also see a lot of opportunities to partner with other organizations around the world, even inside the US, to sort of bring Prenuvo inside to someone else's business. And we already launched one of these sites in Miami where we put a machine inside a longevity practice. We're launching in a couple of months a machine inside so I think we're really open to different ways. I think this can, the technology needs to go where the customers are. And sometimes I think that might be, these are the wellness businesses, longevity and wellness business. Sometimes this might be the health systems, and we're talking to a few health systems to bring Prenuvo into their health system themselves. So I think the technology will proliferate. There will be competition. There'll be other companies, but we're at the beginning of a fundamental rewriting of the entire healthcare system, I believe, and that's huge. I mean, it's the largest industry in the world. I think there'll be, and hopefully at the end of that, we end up with a bunch of options for consumers that they didn't have before, that empower them with their health, and that are high quality clinical businesses.
And I guess part of it will depend on how deeply integrated this technology becomes as part of the traditional healthcare delivery system, right? I think probably the less integrated it becomes, the more you're going to be thinking about, things like longevity and gyms that are maybe cash based and outside of traditional healthcare ecosystem, the more it gets integrated in, and sort of the more avenues you have.
It's true, although gyms are hiring doctors now. So, it's, who knows? I think it's really interesting and exciting that there are these, particularly around primary care, primary care is going where customers are too. And you see these like new offerings. The founders of, for example, one of the former founders of Whole Foods started a business called Love Life, which is like this incredible facility actually in Los Angeles. And it's a gym, and it's a social club, and it's a health checkup, and there are physicians there. So I think everyone's sort of trying to figure out how to reinvent healthcare and move away from this. Like, in some ways, the reactive healthcare system is a little bit, it's become so scary to so many people that I think, a lot of folks are looking to reinvent it in a different context.
When you're deploying at a gym or a longevity clinic, so on site at someone else's facility, are you still staffing with Prenuvo radiologists?
Yeah, we still do. We're doing all the readings. We're not outsourcing that to other folks. That for us is, it's really important for us to know that we're using the right hardware. We have the right image acquisition protocols that we've developed, and that radiologists are being read by radiologists that we manage and we can do QC of and, train and, they function as a practice.
There are competitors or peers that are advertising lower price points. They were historically at similar price points and recently have come down to lower price points. I'm wondering what your thoughts are. Do you see Prenuvo going in that direction? Is that marketing, but maybe behind the scenes or in the fine print there's higher cost? Or is it not comparable because they're offering technology only, you're offering sort of integrated technology plus professional services plus the hardware? What are your thoughts on that, the pricing dynamic?
Well, our goal is to make these scans as accessible as possible. It was one of the first things we did when we founded the company is we looked each other in the eye and we said, we don't want to like do another $30,000 physical. This is going to be something cheap enough that at least a larger segment of the population can do. So we want to bring the cost down, and we have been. In fact, we've been bringing the cost down of some of our cheaper scans, and that core comprehensive scan, it's been $2,500 for 15 years. So it's effectively sort of gone down probably 60 or 70%. And at the same time, there's always a trade-off between, there's folks out there that, they'll say they've got this great AI and it means you can scan people faster. Well, we have AI too. I mean, the fastest scanner, AI-driven scanner I could do of your body is 3 minutes. And you can imagine for 3 minutes of time in a machine, I could probably do it very cheaply. I could undercut everyone. Now, so why don't I do a 3-minute exam? The reason I don't do a 3-minute exam is because it will suck. Fundamentally, it's going to miss things. It's going to see a lot of shadows in you, and we're not going to know what it is. It's going to create a lot of, downstream work to sort this out, and we don't believe it's in the interest of the patient. So that's always the trade-off. Cheaper is not a problem. Cheaper is easy. Being cheaper and high quality is hard, and that's sort of like the promise that we make is that regardless of the price of we're offering something, it's going to be high quality.
Yeah, look, it's an interesting and rich point. I mean, there's a lot of new entrants in healthcare in all different forms, clinical, non-clinical. And, I think from having been in healthcare, now for 15 plus years, it's the quality piece and that balance that's interesting and that makes it complicated. And you don't want to be too stagnant that you're not allowing innovation and you're using sort of the ways of yesterday to defend the status quo. But at the same time, the quality component is very real. And so I think that's what makes it particularly interesting and particularly delicate in our space.
And unfortunately, I think a lot of consumers don't. I mean, it's not like they do, they go get these scans from two different providers and they're sort of able to compare those images side by side, but we see them and we can see a huge difference. So it's just, I think the market, so adds another layer of difficulty to this market. There's people that don't know we exist. There's people that know we exist that don't know, that don't know whether they should do it or not. And then now you have to understand which are the good people and which are the high quality players and which are the lower quality players. So it's a lot of cognitive overload for the average person.
Yeah, it's a lot to ask of the patient. And look, the difference between choosing the right party and not is, this could be a wonderful life-saving technology or service. It could be a cost-saving, total cost of care reduction service. or it can just be another duplicate test if you end up going to, get the 3-minute scan. That's not really, that helpful.
Well, I
So
wish.
it's complicated. That's part of the reason why I think the insurance piece of it, even though it's far from a perfect barometer, but it does help validate to some extent, who's been anointed and who's approved as a reimbursed procedure.
Well, I think the other option, and this is what we do, is we publish outcomes data. So we assess, we follow the health of people that we scan.
Mm-hmm.
We follow people where we think that we've mainly done this in the context of cancer, but we'll do it in other diseases as well. But when we talk about cancer, where we see a highly suspicious lesion, we follow it and see how many of those end up being cancer. And we know that 1 in every 2 that are biopsied are cancer. And by the way, that's a better rate than the biopsy positive rate from many other screening tests. We know what we miss. And, you have to study this because that's the only way you get better.
Yeah.
And we try and provide that information for patients so that they can get a sense of, like, again, what reassurance can you get from these scans? So I think the industry can also self-regulate that way. So if someone wants to do a 5-minute, like $100 scan, as long as they're able to communicate very clearly to customers about what they should expect from that. I don't have a philosophical problem with this. I just don't think we feel comfortable doing it as a clinical practice.
Last question, maybe just spend a minute or two on your international expansion. That's a big theme for us at Scale, is the cross-pollination of best practice globally and the expansion of some of our US-based healthcare companies internationally, which we're starting to see early signs of. And it sounds like you're the next CEO on the list, that you've moved to Australia, you're planning to move to the UK. So we'd just love to hear how that's going, and maybe any early signs of differences in adoption, differences in starting up. And also, how far do you plan to go? Do you plan to expand beyond the UK and Australia? Is this a big part of your strategy, or on the periphery?
Well, I should maybe, just for background, we have 3 values as a company. The first and sort of North Star is act in the interest of the patient. But, beyond that, how do we do that? We have sort of 2 values. One is, pioneering. It's sort of, we're always experimenting and trying to figure out how to do things better. And then the second is, we call it platforming. Is like, how do we figure out what works and then, like, find a way to scale that up? How do we make sure that every day the service is like 1% better, because those results sort of compound over time. And so we didn't move internationally because we really needed to figure out the operations of running this thing at scale inside the US. And that's taken 6 years. And we finally looked up and said, oh, we think we're ready for this. Let's go and do another market. And it's just been a learning. Every market is different. There's a lot of regulatory issues in healthcare that make it really quite difficult. I mean, I sort of naively, in some ways, said, let's do Australia, let's go to the UK, let's do a bunch of these other markets. But if you really look around, there's not that many multinational health companies. They tend to be very national. So, there's a lot of learning along the way. And I'm okay with that, as long as we don't experiment with the clinical quality, the clinical experience that the customer gets. So there's a lot of lessons learned. There'd be a whole podcast worth of stuff that we did wrong, that we, in hindsight, realized we were silly. But, mainly it's in our go-to-market. And how we engage with customers or work with physicians, or it's just been a journey like any other startup.
What are the maybe 1 or 2 things you're doing differently in the UK based on the learnings in entering a new market in Australia?
Well, we didn't fully appreciate some of the very finer nuances around, like, expectations of medical practitioners and radiologists. It's very different. They use different systems to do the radiology, and so we asked them to use a different system they're not used to. Becomes very problematic. There's difference in regulation. We have a lot of celebrities that talk about us, and the way you can talk about those businesses in the UK, let's say, or Australia, is totally different. I believe the average person comes in for a scan because they've heard about us from 3 or 4 different directions. So we do a lot of customer stories. If you go to our website in Australia, you don't see any customer stories because they're illegal. They're not allowed under the regulation. So it's just, there's all this stuff that you can sort of, you try and anticipate 90% of it, but there's always a few things that you miss out on. And you sort of, like, do your best to react last minute. That might be in the week before you launch, or it might be the week after you launch. But it's, just being sensitive to the local realities of the stuff, the people you have to work with, and the regulations, of which there are many in healthcare.
Yeah. Well, you mentioned that there are very few international healthcare companies. And I think it's interesting. There are 3 out of the past maybe 6 or 7 podcast interviews I've done have had some international angle. So one was an orthopedic business that had a presence in the UK and is considering some other markets. One was a cardiology group that the CEO has prior experience internationally, and he's looking to potentially take that company internationally. And the third is you. So it does feel like the time is coming. Maybe we're at the very early stages of that, but that's something that we're interested to watch. So kudos to you for being at the front of the curve.
And to be honest, I don't know how much of it is, incredible vision or just naivety, because, I think probably the challenges of like scaling, really going international everywhere is sort of the equivalent challenge of like Uber going internationally. Think of all of the regulatory issues they came, trying to like operate in so many different markets.
And yet they're there though.
And yet they're there, and then, that now they're a verb. They're in the dictionary. That's the upside. But I'm sure there's also a lot of there's a lot of companies that tried and weren't able to like do such a great job of it.
Yeah, I'm sure that's true. Yeah. Andrew, I want to thank you so much for the time. Very interesting to learn about what you built at Prenuvo, and I noticed you have a site in New York, so I plan to check it out as well myself.
Well, I encourage you to, and I hope people, if they have questions, that feel free to reach out to our team. Our goal also, there's a lot of people we refer away from our scan if they have specific conditions that another medical procedure would make more sense. So we just want to give people information so that they can fairly evaluate whether these scans are right for them. And I believe, I've done 6 scans now. I started this company because I think being an entrepreneur is a life-shortening profession. We don't eat well, we don't sleep well, we have a lot of stress, we don't exercise as much as we should, and I was looking for peace of mind. And I think it's so hard to describe that to people who don't have it, but I think it's the most powerful thing to have. And so much of my subconscious and conscious energy was focused around my health before that I've now reclaimed because I have a lot more clarity about what's going on. So I hope people get a chance to experience it.
Well said. Well said. Thanks again, Andrew. I really appreciate it.
Thanks, Jason.